On the 19th of June every year, Zambia joins the rest of the world in commemorating World Sickle-Cell Day. Now, this is the day that presents us with an opportunity to maximize our efforts in sensitizing the general public on the condition called sickle cell. Today, we thought of visiting Dr. Sombleni Francis Koa, who from UTH, who is going to tell us more about sickle cell and just what you need to know, and also what UTH is doing to make sure that this issue is addressed and people living with sickle cell get the best treatment that they deserve as well. Hopefully that after this discussion you will be able to see the role that you can play in your community, in your society, in your family, in helping people who might not really have much information about sickle cell to know more about it. You might not really be a sickler, but you might be affected in one or the other. You might have a relative who has a sickle cell, or you might actually have a friend who might be a sickler. So it's important that we have this particular information. Right now, I'm in the office of Dr. Kaur, and it's high time that I get him on the camera as well. Dr. Kaur, thank you so much for according us this opportunity to visit you today and come to talk to you about this subject.
Thank you very much for coming, and thanks for having me.
Thank you so much. 19th of every year in June, Zambia joins the rest of the world in commemorating World Sickle-Cell Day. Just how significant is this particular day?
The significance of the World Sickle-Cell Day is basically to create awareness. As you have rightly said, this is a condition which is common in Zambia, and as not only in Zambia but the world over. So it was seen to be something which was important to allow for communities to be able to understand the genesis of this particular condition, and that it's a condition that can be managed, and that people don't have to live in pain and without knowing where help can be sought with this type of condition. So this is seen as a way of making sure that the message gets out there, and that there is help, and that this condition can be managed.
Thank you so much. You are among the few doctors that we have in Zambia who deals directly with people living with sickle cell and relatives of people living with sickle cell. When it comes to the level of knowledge here in Zambia in relation to sickle cell, how is it?
I would say the knowledge is very good. Remember, the condition is very common in Zambia. So in our training in medical school, it's one of those topics which is a must know. So every doctor just at the time of finishing has a good knowledge of sickle cell disease. In addition, at least, and not only doctors here, most health workers, it cuts across nurses, physiotherapists, pharmacists, those who work in the lab. It's cross-cutting, so the knowledge is there and it's good, and most doctors will be able to manage it correctly in most parts of the country. So at least because it's very common, we ensure that it's taught right there in medical school and other institutions alike.
Interesting. What are some of the common myths that are associated with sickle cell, especially just among the general public?
Common needs.
Common myths.
Common myths. To talk about myths, I would have to mention first where it's coming from. So it's an inherited condition, so it's passed on from parents to their children, and it has to be both parents.
Both parents.
Yes, sickle cell is not passed from one parent, it's passed on from both parents. So each parent will have the sickle cell gene, and provided that one gene from the father and one gene from the mother do come together, that will produce a child with full-blown sickle cell disease. However, if the child only inherits one gene from one parent and doesn't inherit another from the other parent, they only become what we call a carrier.
Okay.
So they carry the gene, but they don't express the condition. So for sickle, there has to be inheritance of both from two parents. So one myth would be a husband like myself blaming it on my wife, or vice versa. Another myth would be, if both parents don't know, it would be coming from the community, probably thinking that either one of these parents did something wrong, or from their ancestry, something has come to haunt them. So those are some of the few things that you hear accounts of people telling you in the consulting room. But of course, those who are on the ground, I think, would probably have more accounts to share in this regard.
You mentioned how one can have a full-blown sickle cell condition and it has to be inherited from both parents.
Correct.
Now, in relation to just a carrier, are they also affected in the same way that somebody who is carrying a full-blown sickle cell is affected?
Very rarely, and almost not, no. So that's why in our clinic, it's very rare that I'll see a carrier.
Mm-hmm.
Almost 100% of our patients are full-blown sickle. So carriers are fortunate in that in almost over 90% cases will not express the presentation that someone with full-blown sickle cell will present.
Okay. What makes sickle cell a very delicate condition?
So a bit of background again. You see, as human beings, one of the major systems which helps to keep us going is the circulatory system. And in the circulatory system, there are basically three types of very important organelles, cells: the red cells, the white cells, and the platelets. The red cells are the most abundant, and these ones, the major function is to carry oxygen from when we breathe in, oxygen from the atmosphere to our organs and tissues, which need oxygen to survive and function, and then also to take out carbon dioxide from our tissues outside. Now, in sickle cell, the problem is with the same red cells. So the component which the red cells contain, called hemoglobin, is abnormal in sickle cell. So that's why it's called sickle. It's sickle hemoglobin. And because of that, that is unable to bind oxygen properly. And in cases where that oxygen is low, the cells end up becoming deformed and take on a funny shape of there's this cutting tool which was used years ago for threshing wheat or grain, and it's actually called a sickle. So that's where the name comes from. So as a result of that, it goes right to the core of our daily survival, which is oxygen transportation to the rest of the systems of the body. So with that affected, you can imagine now the main presentation now will be when oxygen is low. Everywhere where it is low, the main presentation will be that of pain, severe pain. And in addition, if there's not enough supply going to the area, the tissue is going to die. When tissue dies, it leads to all other kinds of complications. And because we know this is the kind of things that we try to prevent. And if they've happened, try and manage.
We're here at UTH, ladies and gentlemen, and that is the hematology department, and I'm talking to Dr. Koa, and we are looking at sickle cell, a very, very delicate and common condition here in Zambia. It's important that you have the information so that in case you have got a family member or a friend who might be living with this condition, you can be of help as well. For now, we take a very short break. We'll be back shortly. All right, so we are looking at sickle cell, knowing the fact that 19th of June every year, Zambia commemorates World Sickle Cell Day. And this day gives us an opportunity to, to increase the level of awareness among communities in regarding this particular condition called sickle cell. And today I'm privileged to be talking to Dr. Koa from UTH, who is helping us understand this condition in detail. Now, Dr. Koa, correct me if I'm wrong, really. From my personal statistics and just the interaction that I've had, I've come to understand that sickle cell seems to be gender biased in one or the other. It seems to be affecting mostly women as compared to men. I don't know. Is that true?
No, it affects us equally. Okay. Remember, the inheritance is that of a gene from one parent to another. So it's what is known, the scientific term is autosomal recessive. So autosomal doesn't select for sex. So it's not sex linked, it's autosomal. Autosomal can be either male or female, and you can either have either one or the other. So we can't say, if you do a head count and find more females, that shouldn't tell you that no, it affects females more. It just means that in this population, most of the females have been born with it. Otherwise, the probability is 50-50.
When it comes to management of sickle cell, what are some of the do's and don'ts that you usually advise sickle cell patients to observe?
Three very important things which can be done in the home. Number one, hydration. Hydration is basically maintaining very good levels of water or fluid in the system. So water is the easiest and most accessible, but any other fluid, not of an alcoholic nature, will be good, because then it keeps the system fluid and it helps the blood flow in the system. That's number one. Number two, warmth. Warmth is critical because when we keep warm, it helps our blood vessels to remain dilated, and this allows blood and cells to pass through easier than when it's cold. Blood vessels shrink to try and conserve heat. But now when they shrink and you've got these abnormally shaped cells passing through, it can cause blockages, and those are the ones then which lead to complications. The third one is management of pain. So In sickle cell, aches and pains are going to occur and more frequent than in the general population. So we generally emphasize and advise that there should be some pain medication in the home, which can be taken before even going to seek medical attention in the health facility.
Many people usually believe that patients of sickle cell don't live longer. How true is that?
Where it's not managed properly and those principles are not followed, the consequences can be dire. Yes, that is true. But where there's good care and those principles are followed, then sickle cell patients will do very well. In some cases, they may have to tell you that they have the condition. You will not be able to tell by looking.
Which part of or which age group seem to be more vulnerable and usually experience rough periods, especially if at all they're living with this condition, between children and adults as well?
This is an inherited condition, so most times it may not show up at birth, but will show up around roughly between 3 to 6 months. Reason being, during that period is when there's a transition in the body from the hemoglobin of a child to that of an adult. But remember, in sickle cell, they have abnormal hemoglobin. So when the transition is taking place, then the deficiencies start to show. And it's usually picked up around that age group. And that's usually the time when the effects are quite severe. So most times it's in children.
Is there any special diet that you usually prescribe, that you usually advise sickle cell patients to be taking?
Not entirely. They can eat whatever else any other people in the population will eat, and they'll be absolutely fine. I know that in our setting, there's encouragement of vegetation and certain foods which are believed to boost blood levels, and we have no objection to that. I mean, it's all of it is mostly healthy, so that's okay. But at the end of the day, most vegetable diets contain a compound known as folate, which is found in folic acid, which we do give as a supplement because this helps them to build up reserves of the red blood cells. So that's, I mean, we have no objection, but then there's nothing like a special diet for sickle cell disease now.
You've talked much on management, but I didn't really get much on treatment. Does it mean is there any treatment for sickle cell?
There's no specific treatment. No, this is a condition for life. There are some special medications which can help to control. So in the hospital, there's a particular type of medication known as hydroxyurea. This particular medication helps to boost up an alternative type of hemoglobin, which is very good at binding and conserving oxygen. And if that happens, it just helps those with sickle cell disease with very high levels of the abnormal sickle hemoglobin to be able to have less crisis. And in some cases, they can be crisis free for long periods of time, going to as much as a year plus. Of course, this medication will have side effects for others, but for a good majority, it's a very, very good game changer. And we've been privileged in this country that it's been provided through government. Of course, it's been a bit erratic of late, but it's a commitment that has been made, and it's at no cost then to all these patients. Another upper level of actual treatment now, which is it provides for a cure, is what's known as bone marrow transplant. All blood cells are produced in the bone marrow. So now if you change the bone marrow of someone with sickle cell and give them a marrow which doesn't have, then you will have cured. And this has been done. There are studies to that effect, and there are people who are actual living proof. So this is one technique which we could lobby for. I mean, it's something that can actually be set up locally and would be of great benefit, especially to our younger patients. To be very, very helpful. Those who, in adults, this procedure may come with a lot of complications. So in that case, we rather have an alternative like hydroxyurea, which is just a tablet once a day or two, and helps to keep them crisis free and allow them to live a normal life.
UTH, how is it addressing the needs of people with sickle cell?
Well, we have dedicated clinics, so dedicated clinics for children, dedicated clinics for adults, so right through the spectrum. From and then of course for women before they deliver, there's also care in that sense. So right from the womb throughout. So the clinics are for those who are stable, just to ensure that they stay stable. Then of course we know that once in a while there are those who are going to come in critical. So the emergency services are there to ensure that such patients are received. And like I mentioned, almost all our medical students, this is something they're taught. And if it's not known in children's hospital, it's just a policy that we test for it, like automatically. In adult, it may be difficult. Someone will have to tell you, and of course, when they tell you, then we'll know exactly what to do. It's definitely pain management, and you might fluid, and in some cases where because their blood levels have gone very low, we need to transfuse just to replenish, help the system to replenish what it has lost.
Finally, 19th of June, any special activities that UTH, Department of Hematology, usually plans in relation to this particular day?
In this particular day, we like to make it a community event to get the message out into the community and not make it a hospital-based. because most of our patients are coming from the community. So if there are going to be any activities, they're going to be outside of the hospital, in the community, where the sensitization will take place. And of course, we do make sure that we're part of it, and to support our patients in this venture. But otherwise, the screening for volunteers, especially those would-be parents and parents who don't yet have children, or for any members who may have a relative, a distant cousin or something, all those are encouraged just to know their sickle status.
Well, Dr. Koa, thank you so much for according us this opportunity to talk to you on this subject.
Thank you very much.
Thank you so much. All right, so that was Dr. Koa explaining in detail what UTH is doing in managing and addressing the issue of sickle cell. And from his explanation, quite a lot is actually being done. And this has even enabled, patients living with sickle cell to enjoy living a normal life and also to live and be part of the community as well. So if you're an individual who's got a relative and that relative is on sickle, he's a sickler, he's a patient for sickle cell, please provide that necessary environment, a conducive environment that will enable them really to enjoy. Make sure that they observe those 3 cardinal points that Dr. Koa did highlight. Make sure that they observe those, and if they're on treatment, on drugs, make sure that they take their drugs according to the prescriptions by the doctor. All of us can actually do something to make sure that we win the fight against sickle cell. At the moment, government is doing its part, UTH is doing its part. It's up to you as a community to do your part as well. So every year as the 19th day of June comes, make sure that you also get involved in community-based projects that UTH initiates, and of course other health centers across the country that they initiate. After this break, I'll be talking to a sickle cell patient just to get the side of her story as well and how the roller coaster has been on her case. All right, so as we look forward to having a very progressive rest of the year, and as we look forward to being, productive and more responsible citizens in our country in terms of, creating a conducive environment for people with a special condition, today we want to make sure that we dedicate our efforts, our time in, raising awareness in relation to sickle cell as well. It's being done at worldly level, and here in Zambia we also want to make sure that we do our part in making sure that our friends, our girlfriends, our boyfriends, our husbands, our wives living with sickle cell always feel part and parcel of the country, part and parcel of national development. Earlier I was talking to Dr. Koa, and we talked quite a lot about sickle cell, some of the myths, and of course just how you can contribute to proper management of sickle cell. And I did promise you that I'm going to be talking to a very good friend of mine who's lived her whole entire life with this particular condition. The truth of the matter is that it hasn't really been easy, but she's beaten the age of 30, and currently she's actually above 30. One of the greatest myths that I've come across in relation to sickle cell is that in many cases, many people believe that sickle cell people don't live beyond 25, but she's lived beyond 30. So maybe it's important that we get to find out more what has been her secret. Okay, Rimba, good to have you.
Hi, Nelson.
Good to see
How
you.
are you?
Thank you so much.
All right.
How are you?
Okay.
Okay.
Long time.
Yeah, well, a long time. Looking fresh.
Thank you so much.
I heard that recently you had an art exhibition.
Yes.
How did it go?
It was good. It was good. First time experience. I was nervous, but it was good.
Okay.
Yeah.
Great. What are some of the comments, both negative, positive, that were coming from people who came through to see what you can do?
Okay. Yeah. So on the positivity, there was enough color. Okay, there was brightness all over it, so I should keep it up. On the negativity, they said that I should watch my strokes.
Okay.
Some were not very clear. So we always appreciate critique because it improves us.
Well, sorry,
Yeah.
I don't even understand what you meant when you talked about stroke. Exactly, but I would definitely think and believe that, wow, we had 60% positivities, 40%
Yes.
criticisms.
Yes.
Oh, that's
Yes.
beautiful. All right, so now 19th of every June is usually World Sickle Cell Day. Zambia
Exactly.
joins the rest of the world in commemorating sickle cell, a day
Yes.
that presents an opportunity for us to tell our neighbors about sickle cell. You are a sickler. How has it been life for you?
Well, sickle cell is not easy. And like you're saying, we come to celebrate this day because we know how difficult it is and we want to make public information. It has not been easy at all, especially in the teen years. Those are the hardest because people are always laughing at you. You're always hearing negative comments. You not live past this life. But you come to a situation whereby you accept who you are and just say, I'm going to live no matter what, because at the end of the day, my life is in God's hands. Yeah.
We have lost a number of gallant young men and young women
Yes,
because of
yes.
sickle cell.
Absolutely.
Exactly, as a result of perhaps depression,
Yeah.
failing to accept the condition, failing to fight stigma, failing to
Yes.
fight discrimination, not really having a proper support system.
Yeah.
How has it been for you? You're
Okay.
above 30 now, which is, wow, remarkable.
Remarkable.
Exactly,
indeed.
remarkable. Only God
Remarkable.
knows how you managed to hit above 30.
It's true.
Exactly.
It's true.
How have you managed to survive the stigma, the discrimination and all that?
Okay, so like you're saying, the stigma is very real, okay? And like you're saying, the support system is what helps one to get through the stigma, because you find that even when you go to school, people are laughing at you, you're always sickly, you don't attend classes, you're always catching flus. So it's a situation whereby people are always saying, oh, that sick one, oh, that sick person, so you're labeled as sick. As a result, you grow up thinking that you're not normal. So for me, I have survived because of a great support system. My parents have been supportive, my sisters have been supportive. But remember that support is only there at home. Others don't survive that support, don't find that. All sicklers don't find that support system in their schools or in their communities. So it's important it's important that as a community we help these people living with sickle cell. We support them. We tell them you're okay. You don't laugh at them. You don't extremely go stigmatization on them. That will help with the support system, because even if they're at home or at the community, they know people are with me.
Okay.
Yeah.
One key issue that Dr. Kaur also mentioned when I was having a chat earlier with him is the fact that, you know, one of the key symptoms of sickle cell is extreme pain.
Yes.
And I'm sure it's something that you have gone through as well.
Yes.
So how has it really been? How do you you know, endure
Yeah,
that
that's
pain?
true. With sickle cell, there is absolutely no way you don't go without pain. Okay, seasons come and go, especially in the cold season. That's the time when we are really prone to a lot of pain. But we manage it through hydration. We drink a lot of water. Okay, then non-stressful environments, then taking our medicines as well. So medicine is the key. There are certain drugs the doctors puts us on everyday tablet, and also those that manage pain. So when we are put on that, it suppresses the pain, and the pain can get very real, because with sickle cell, when someone is in pain, they literally scream the whole night, and it takes a good 3 days for pain to literally wear out. So it's a terrible, terrible thing, but we get to know how to manage it. Yeah.
Okay. How flexible is your dad?
Okay, so with sickle cell, there's no special diet. There's really, really no special diet. We can eat anything. The only thing the doctors emphasize is increase in vegetables. Okay, so anything that has a strong green element, because we're looking for the folic acid in that. So there's no strict diet. Also, we restrict cold things, okay? Things like cold fizzy drinks, carbonated drinks, cold water. Those are a big, big no, because that also will lead us into a crisis. Yeah.
Is there a time when you thought you cannot go on, you cannot just live any longer? Are there times when you feel that? Are there times when you felt like that before?
Yes, absolutely. Many times. Even now. Even now, because like I said, the stigma is everywhere, okay? But worst in my teen years, because at school, they would always tell you will not live beyond this age. Then you're always on drugs. The worst part about being a sickler is the drugs, the medication that you have to depend on. You can't live without drugs. Go 3 days without drugs and you are going to find yourself in hospital. So that is the worst part. Literally moving with a bag that has to carry drugs, tablets, a first aid kit to make sure that we are living healthy. So that is the biggest challenge. So I have felt that, especially in my teen years, where you wake up and say, what's the point? What's the point of waking up every morning to suffer, to go through all this? And even today, as much as of course I've grown out of it, days like that do come, because I mean, as a normal human being, you have that time when you look at yourself and say, but this disease is real. Yeah.
When you began understanding this condition that you have, did you at some point become a victim of depression?
Yes,
How did you
I
survive?
did, actually, when I was in a wheelchair. So because of sickle cell, I had a bone complication that locked up my knees and my feet, so I couldn't walk. That resulted in me being in a wheelchair, and I was on a wheelchair for 2 whole months. It's a situation where the doctors were saying, well, these things take time, so they couldn't even give me a time frame, you know. So it was obviously either or. I was totally depressed during that period. That was 2017. I thought I would never walk again. I remember crying and saying, God, why? Why did you bring me here? Why am I in this situation? But, you know, life, you can't change it. You take what is thrown at you, you know. So, but to God be the glory, here I am walking again.
Okay,
Yeah.
interesting.
Yeah.
All right, so now we know for sure that, you know, out there we have, you know, people living with sickle cell who barely have a smile like you do, who barely really enjoy life as you might be doing.
Yeah.
Exactly. Maybe due to 1 or 2 things. What would you have to say to them?
Okay, so it's a good point you've raised there, because not everyone is as strong as I am. A lot of them are very weak because of what we go through. So it's one of the reasons why I started volunteering. So I speak before a crowd of about 50, 60 people, either at Levi Mwanawasa or UTH, just to encourage them to say, this is not a death sentence. So back to your question, the advice I would like to give my fellow warriors is that I know it's hard. I know the situation can be difficult, and there are days that you don't want to live at, or you don't even want to look forward to a day. But at the end of the day, this is the life that you've been given. There's nothing that you can do about it, okay? The only person who can change this is God. But as we're living, you know, be strong, be courageous, you know, take a look at other people as well. You know, it helps when you look around you. There are people out there who are blind, who are struggling with tumors and cancers. So take courage, take heart. It's not easy, but when you accept your situation, you begin to live a healthy life. You begin to look brighter and smile more, because you know that at the end of the day, sickle cell does not define you. Yeah.
Well, Limba, thank you
Thank
so
you
much.
so much.
And good to see you again.
Indeed.
Hopefully you're not going to
Greatly.
disappear on me now.
No, not at all. I'll be in touch. Thank you so much.
All right, so ladies and gentlemen, that is obviously the take-home message from Luimba, and of course from us here, and from UTH, the Department of Hematology. The take-home information is that if you are a sickle cell patient and you're on treatment, please abide your treatment. Those 3 key points that Dr. Koa did talk about, please observe them. And if you have got a relative who is a sickler, who has a sickle cell, make sure that you provide that support them in medication, in management, in dietary issues, and also in observing all the rules and regulations that have been given. If you are at school and you have friends who have got sickle cell, please do not stigmatize against them. Just do not discriminate. Support them and look at them as part of society and as active people who can contribute to national development. We have another opportunity this year to show our, you know, our support and our responsibility as well on the 19th of June, as Zambia joins the rest of the world in commemorating World International Sickle Cell Day. Please be part of the family, and together we can do it.